This video is part of a collection of testimonials and stories about the personal and professional impacts of public health emergencies. This project aims to uplift authentic experience and impactful efforts to enhance the capabilities of agencies who serve maternal and child health populations and help guide their use of existing resources and implementation of best practices in their communities.
Hello, my name is LaShay Canady, and a little bit about myself. I worked with the State Department here in Denver, Colorado, and we talked a lot about family leadership. I am a family leader, as well as working on the state team to spread this statewide, and also I am a full-time caregiver for my daughter. And today's goal is about the emergency preparedness and kind of planning for that. Like what is involved in planning and why do you plan? And so it's my honor to discuss that today. And so this is Sharday Collins. This is my daughter. She has a birthday coming up in October. And so it's just, what is that big overall holistic approach to her life and her needs, as well as for Lincoln. And I think Lincoln, you moved in, this is Lincoln Decrest, and he moved in 2013, and he's been with us ever since.
Tell us about your personal experience preparing for emergencies in your role as a primary caregiver for family members with complex medical needs.
I'm thinking about, okay, what do I need to do to make sure they have a second exit out of the house, a ramp to get out of the house and to the street, or the Xcel Energy notifications of the power is out. Are we on the notification system to get the power on as soon as possible because they have durable medical equipment? And so that's a free service that the state of Colorado has. And let's say the water is not working or the power goes out. How do I make sure they're still eating and heat things up? And let's say we have to be evacuated. What do we do in that situation? So I'm always in that planning mode of what are their needs, and even putting the emergency preparedness suitcase together. What do I need in a week's time for just Sharday, right? And then another suitcase for myself of making sure that I've covered all what happens in 24 hours. And I may forget something, so I'll find that out when the emergency happens. But we at least have a plan of if there's an evacuation, if there's a tornado, if there is a fire, wildfire, or a tree falls on the house. What do I need to plan for that? So here is the emergency preparedness suitcase that I thought of maybe, 10 years ago. And we have updated it since, and it's good to think about all these things from emergency preparedness perspective. And so put this up here. And this is what I think about for my daughter and what are her needs. Say we need to be gone from the house for a week. And so it's about her medical needs, oral health, and what about her mental health, right? And what does she need in a 24-hour time? And I double that.
What specific considerations related to transportation are vital to the safety of those who are wheelchair users?
Absolutely. She feels safe. Battery to her chair. Do we do a manual chair? Do we do a power chair? Do we get into the van when there is an announcement to evacuate? Do we wait? Do we go when we think it's time? And think about the transportation. Are the roads clear? Where do we go? Is it wheelchair accessible? Will they meet our needs, both for Sharday and for Lincoln? And making sure that everyone feels safe and that all needs are met. So I think it's important just to think about the what ifs, and that's the planning part.
What aspects of medication access and storage are compromised during an emergency?
Take an example of thinking about the medication during these emergency preparedness situations is that Medicaid will only cover medication for a month or one dosage, and you can't double up to say, okay, in case of emergency, I want to have double. Medicaid is not going to pay for that. Say, for example, if you do go to a shelter, is there refrigeration for insulin? And what does that take? Do you need a portable little refrigerator? Will they have one when you get there? And you have to think about those things as you're preparing. And so with Lincoln and having insulin, we have to make sure that there's a refrigerator in his room now on a daily basis. What happens when we need to go to a facility? Very important to think about when Medicaid is your provider.
What recommendations do you have for public health professionals to better communicate and plan for emergency scenarios that disproportionately impact people with disabilities?
Today, I wouldn't know where to go if it's a YMCA, if it's a rec center, if it's a school, if it is a stadium. I wouldn't know where to go for the type of emergency, right? And so I don't know if that's something that needs to be taken into consideration of, if there is a tornado, just get out of the way. If there is flooding, you go here. If there is a wildfire, you would go here, right? Like just those different scenarios that could happen. I don't know where we would go. Higher ground, to another relative, to a location, to a rec center, right? So I don't know what that looks like. And I don't know if it has to happen before it is realized, but just being aware of maybe where the rec centers are, higher ground facilities, the city of Aurora, or you go to higher ground. What does that mean? And where do we go? I think that's a disconnect as well.
What recommendations do you have for agencies who serve maternal and child health populations?
There is this kind of, you're in your mind, you have your policy, you have your written instructions, you have your procedures, you got your head in the game, right? And then the heart space is like, wait a minute, okay, I got two people. Okay, be ready to get them out of the house. Okay, where do we go? Okay, do we leave now? Do we leave later? Is there any message that comes out to the families? Is it a phone call? Is it television? Is it a text to everyone, right? Or a siren, right? Like, so I don't know if there's a universal warning, but at least text out to the people who are the boots on the ground and making sure that they are aware. This is what's happening. Be aware. If the text needs to be a siren itself, inform the people who are in the emergency situation so that they know, okay, we anticipate you have a couple of hours. We anticipate you have 30 minutes. We got someone walking around knocking on all the doors to let everyone know in a neighborhood. Or what are those contacts in communities that can be that responsible person, like a DARE officer or a community officer that is responsible for getting the text out to everyone. And so I think the public health department needs to think about those things of, what is your system when there's not an emergency in place, so that when the emergency happens, everything runs smoothly.
Thank you, LaShay Canady, for sharing your family's emergency preparedness plan and offering thoughtful considerations for the MCH workforce in responding to future public health emergencies. This anthology is curated by the Association of Maternal and Child Health Programs, or AMCHP, through a project funded by the Centers for Disease Control and Prevention, or CDC.